So let's have a look at the pathophysiology of pneumonia. Now, if you are looking at the pathophysiology of any disease condition, you are trying to look at how the disease actually got to affect the person. All right? Pathophysiology of pneumonia. So for pneumonia, everybody knows pneumonia is a disease condition that affects the lungs, right? Where you are having fluid in the alveoli, while the alveoli are supposed to be empty so that it can be able to now contain air. You are now having fluid filling up there. So now the patient is not breathing the way they should want, or how will I put it? Their alveoli is filled up with fluid. So now they are having difficulties in breathing. That's one of the classical symptoms. That's one of the first complaints that the patient will complain about. Okay. So we say that pneumonia is an infection in your lungs caused by bacteria, viruses, or fungi. Pathophysiology, we are just trying to look at the cause, how this disease will present. Okay. Pneumonia causes your lung tissue to swell, that's inflamed, and it can actually cause fluid or pus to actually accumulate in your lungs, right? Bacterial pneumonia is usually more severe than viral pneumonia, which can often resolve on its own, right? Pneumonia can affect one or both of your lungs, all right? Pathophysiology now. People get pneumonia from inhalation or aspiration of the microorganisms that can cause this. Then, after the inspiration or aspiration, there's a spread through the blood. That's hematogenous spread, okay? So these are the three mechanisms by which pneumonia actually reach the lungs. It's either you inhaled it or you aspirate, or it actually spread through your blood to the lungs, right? So the primary route by which organisms enter the lower airways is aspiration of oropharyngeal secretions into the trachea. All right. So it could be that the organism is right there at your neck. Okay. Or not really. Aspirate, like you inhaled it in. Okay. So aspiration and inhalation is basically the same thing, right? So aspiration pneumonia results from what? Aspiration of colonized upper respiratory tract secretions. Okay, the organism was right there at your upper respiratory tract. Okay, then later on you had to take it in. In healthy individuals, roughly about 45% of population is estimated to aspirate during sleep. With critically ill patients, likely they aspirate more frequently. Okay, so hematogenously acquired infections originate from a distant such source and they reach the lungs via the bloodstream. Okay, hematogenously, they spread through blood. So it could be that pneumonia, even the organisms infected it through the leg, they were able to grow there. But because they were able to get into the blood vessels, they now spread to the lungs. Do you understand? Hematogenous spread. So this is just a briefing on the pathophysiology of pneumonia.